And the schools that survived were specifically, exclusively the ones teaching pharmaceutical intervention-based medicine. They were teaching doctors to diagnose a symptom and prescribe a patented pill.
But they didn't just rely on funding to kill off the competition, right? They used the law. Let's look at the Shepherd-Towner Act of 1921.
Yeah, this was a huge blow.
This was a piece of federal legislation that seemed, on the surface, to be about public health funding. But the fine print was a literal death sentence for alternative medicine.
The Shepherd-Towner Act tied federal funding to programs that were staffed exclusively by doctors from those newly accredited Flexner-approved schools.
Oh, wow.
This meant that if you were a highly skilled, holistic doctor who had been delivering babies and treating illnesses successfully in your community for 30 years, you were suddenly locked out of the institutional system.
You couldn't get a job.
Right. You might be grandfathered in, meaning the state would allow you to keep your personal license to practice until you retired or died, but you were legally barred from training new practitioners, and you couldn't be hired by federally funded programs.
So the knowledge was quite literally legislated into extinction.
Exactly. It just died with that generation.
It's a staggering realization. The generational transfer of knowledge was totally severed. And to enforce this newly created monopoly, these interests utilized the American Medical Association, the AMA.